Thank you for your interest in learning more about the CAREAPP project. My name is Vanda Lardboon, and I'm the Director of Health Promotion Initiatives within the Bureau of Health Promotion at the Howard County Health Department. CAREAPP is an acronym that stands for Community Access to Resources through Enhanced Technology Applications for Provider and Public. The Howard County Health Department understands the growing need to support healthy living beyond traditional healthcare settings. This project focuses on addressing the social determinants of health and understanding how they impact health outcomes. According to the World Health Organization, the social determinants of health are the conditions in which people are born, grow, live, and age, and the wider set of forces and systems shaping the conditions of our daily life, including access to care, transportation, housing, education, employment, food assistance, and health. CAREAPP provides a single tool for network providers in Howard County and their clients to quickly identify social needs, to select and electronically link clients to the best community resources, and to monitor ongoing social needs for their client. This CAREAPP tool is powered by Healthify, a web-based software. Next, I'll be showing a brief video that demonstrates the functions of the software.
Welcome to Healthify. We're a company that's focused on helping organizations address the social determinants of health. Our platform will empower your organization to find helpful resources in the community, assess social needs, and coordinate referrals, all while measuring what's being successful. It's really easy to use and can be accessed from any device, whether that be a computer, a tablet, or even a smartphone. Let's jump into the search platform first. As you can see here, you're able to search for needs in any area and filter down to the specific service you need. Food pantry in Baltimore? Found it. Support groups for caregivers? You bet. In our search platform, you can even share, favorite, and edit information to collaborate efficiently as a team. Now, while it's incredibly important to find a service, it's crucial to track success and changes. That's why we provide a social needs screening tool to understand an individual's needs and a management platform to see the data on referrals for each patient. This way, you can quickly find a person you are working with and learn more about their specific needs, then track the progress in addressing those needs via referrals. Finally, we provide a system for you to maintain your own service information and coordinate referrals directly with other organizations right through Healthify. All of these great tools come together in an end-to-end solution for social determinants that helps you understand long-term trends and change the status quo. Healthify. There's more to health than healthcare.
For this pilot year, the CAREAPP tool will be utilized by a network of participating providers within governmental and community-based organizations who link county residents to critical resources and support in the areas of health, access to care, transportation, education, employment, food assistance, and housing. Some of the unique product features of CAREAPP tool that I want to highlight and that were briefly described in the video include a robust resource directory of Howard County services and resources that is current, searchable, and regularly updated. A comprehensive risk assessment screening tool that identifies persons in need of health and social support services and resources, again focusing on the 7 social determinants of health categories: housing, transportation, education, employment, food assistance, access to care, and health. Bidirectional tracking of referrals to ensure a client's successful linkage to care. This ability to track client referrals and ensure whether or not they have been successfully completed is essential to coordinating care around the social determinants of health. A customized dashboard of data analytics to track search activity, resource demands, and client referrals within the CAREAPP network. It can also help us identify gaps in the community. And then lastly, this is a web-based platform that is accessible by any device, desktop, laptop, tablets, and smartphone. Here's an example of how the CAREAPP tool could be utilized. Let's say a family enters DSS for services. DSS provider conducts an intake with the clients using the CAREAPP risk assessment tool. The tool searches for relevant resources in the database and produces a summary of recommended resources based on the client needs. So in this example, search results for this family included Chase Brexton for primary care and Community Action Council for the Head Start program. Upon the client's consent, electronic referrals are sent to both agencies via this tool. Additionally, a summary of resource results can be printed for the client. As CAREAPP users, Chase Brexton and CAC will be alerted of this referral and follow up with the client for enrollment and assess for further needs. When follow-up or enrollment has been completed, the CAREAPP tool will notify DSS, also known as closing the loop in the referral process. Let's say the Head Start provider conducted the CAREAPP assessment and found that additional resource was needed, MA transportation. So likewise, an electronic referral can be made and a return response will be sent to CAC to close that loop in the referral process. CAREAPP administrators will have an analytics dashboard to track their team's search activity, resource demands, and client referrals within the CAREAPP network. Our project hypothesis states that if we're able to utilize CAREAPP technology as described in the previous scenario, then we expect to achieve the following outcomes as listed on the right-hand side of this slide. We expect to improve the ability to assess individual and community needs for social determinants of health services, to improve care coordination, again, through that bidirectional tracking feature, to increase client and provider satisfaction with care coordination services and the CAREAPP tool, to identify unmet gaps and needs in the community, and as more of a long-term outcome, to reduce healthcare costs. This diagram illustrates the governmental and CBOs or community-based organizations that we propose for the CAREAPP pilot project year. There are 33 unique agencies that are listed here. As you can see, the agencies are listed in specific social determinants of health categories that represent their main services in Howard County. Some agencies may be listed in multiple categories. For instance, DSS is listed in both the food assistance category for their family investment program and also listed in the access to care category for their medical assistance under care program. All of these agencies were prioritized by their high utilization by clients with the greatest social determinants of health needs in the community. The governance structure for this project is guided by both Howard County Health Department staff, indicated in the darker blue color, and our community collaborators in the lighter blue color. The steering committee was selected based on individuals and organizational expertise in social determinants of health for the respective areas of work or experience. We meet on a quarterly basis. University of Maryland School of Nursing was selected to design and implement a program evaluation for the pilot project. The evaluation will include both quantitative and qualitative measures to assess CAREAPP's effectiveness on the short-term outcomes. Healthify, again, was selected as our software developer. The community-based organizations selected as CAREAPP users for this pilot year will also be asked to participate in technical trainings and small group discussions to address ongoing quality improvement throughout the pilot year. This slide reflects the timeline of our project plan. The key milestones are outlined in the first column. Currently, we're in the process of onboarding the community-based organizations who will be participating in this pilot project. After that, will be coordinating trainings for all the CBO users, and these trainings will be scheduled in a phased approach. The county-wide launch of this tool will tentatively occur in mid-April of this year, and data will be collected and evaluated for the entire 2017 year and also into the first quarter of 2018. Our project team is excited to launch a CAREAPP website, which was designed to provide information about the project to both the general public and to CAREAPP providers and stakeholders. Our website is www.hccareapp.org. I'm going to hop into our website just to show you what information we have on it. So as you can see on this slideshow, it's just exemplifying in how we would like this CAREAPP tool to benefit the community. If you scroll down further, it lists the key product features that I mentioned earlier in the presentation. And also the video that was presented early in this presentation can also be viewed here if you click on this screen or on this monitor. If you go to About CAREAPP section, this gives a brief overview and background of our CAREAPP project, including our short-term outcomes, as I mentioned earlier. If you go to the project description, this gives a brief description of our project more in a Q&A format. This section lists all members that are part of our project team, and again, it's a collaboration between Howard County Health Department, Healthify, and University of Maryland School of Nursing. This lists the organizations that are represented on our steering committee, which meets on a quarterly basis. And here are the network of participating providers for this pilot year. The contact section is where people could send inquiries that will come directly to our project team. This section is specifically for CAREAPP providers, which is password protected, but will be given out to CBO users once they've completed the training. And in this section, there's a link that goes directly to the Healthify sign-in account. There's also a direct link to the Healthify support page, which will house tips and guides and past webinar trainings about how to best utilize the Healthify platform. We'll also be posting CAREAPP updates on this page, such as upcoming trainings. And we'll be also posting CAREAPP news to give a brief snapshot of where we are in terms of progress and utilization, and just basic data analytics. Okay. So please, when you get a chance, visit our website, www.hccareapp.org. Let me just hop back to the presentation. Okay, so this pilot year, participating organizations can designate an unlimited number of their staff to become CAREAPP users. A CAREAPP user is an individual assigned a login and password to access Healthify tool and resources. A CAREAPP admin user is an individual with user access, but also able to review organizational and individual user data analytics. Requirements for all designated users would include completing the necessary training, utilizing the tool, and providing ongoing feedback throughout the pilot year. Additionally, each user will be assigned an access level depending on how they want to utilize the tool. Level 1 is the basic search platform or access to the search platform where CBOs will be able to search for a resource on the resource directory and also be able to print resources for their clients. Level 2 builds upon Level 1. So in addition to being able to search on the resource directory, CBOs at the Level 2 access level will be able to send resources to the clients by email or text. But at this level, CBOs can use their own screening tool. They do not have to use the Healthify screening tool. At Level 3, this is where the CBOs agree to utilize the Healthify screening tool, which will help identify clients' needs and also prioritize community resources. And then Level 4, which is the Coordinate platform, this is when CBOs, in addition to all of those other levels, will be able to send e-referrals to and from CAREAPP network organizations, monitor referrals, again, that closing the loop, and case manage ongoing needs as they arise. This is our target timeline for the product launch. We will be beginning trainings in April regarding the search platform. Then a month later, we'll introduce the track platform, both with and without the screening tool. And then June and into July, we will be launching the trainings for the Coordinate platform, and that's with the bidirectional training, tracking, and referrals. That concludes this presentation, so thank you again for your interest in this CAREAPP project.